Ever wonder what happens to your pet when the vet takes it behind the staff-only door? To answer that question, VCA City Cats Hospital held its first open house on Sunday, June 9th.
The practice has been here over 20 years, and VCA purchased the practice from Healthy Pet Corporation in 2007. VCA's Veterinary Centers of America, we're a national company. We have over 540 hospitals nationwide, and we only buy existing hospitals. We don't build them from scratch. So we like to fit into the communities we go to.
The public got a behind-the-scenes tour of the hospital. Technician Morella explained how an animal is cared for while under anesthesia. Blood pressure is monitored both manually and by machine. In this setting, a cat is most likely having its teeth cleaned. She also demonstrated how x-rays are taken. This patient was having trouble going to the bathroom. The cause? Bladder stones. With an emphasis on prevention as well as healing, doctors and specialists were on hand to answer questions about cat health and care.
The eye examination of a cat is very similar to the examination a human would get if they went to an ophthalmologist. And using the model, the examination would include just a general observation of the face to look for swellings or asymmetries. Then, closing in a little bit more, I would use a magnifying device, a handheld microscope, to examine the surface of the cornea and the front chamber of the eye, which, as we open up the model, would include the cornea, the colored iris, the pupil, which is the opening in the iris, and the lens. Then with another instrument, I would focus light through the clear structures to highlight the structures in the back of the eye.
And what makes cats' eyes glow in the dark?
There is an additional layer within the choroid that has reflective qualities, such that when low levels of light come into the eye, the light has a chance to re-reflect. That actually allows for sharper, much improved night vision in these animals.
But what's normal and what's not?
At normal room light, ambient light, the pupils should not be that large. That can be associated with a variety of different conditions, including potential damage to these tissues in the back. So if your cat's eyes are not, the pupils are not constricting or getting smaller, or if they're always really large, or if they're dissimilar, one is larger than the other, that would be a good indication that you should probably have the eyes checked out.
As a specialist, Dr. Willis also sees cats referred by veterinarians at other practices. Also there were Broken Tail Rescue and Gifford Cat Shelter. Both offer adoption and temporary fostering. It was a fun afternoon learning how cats and the hospital work from the inside out.